We'll now move on to our discussion and questions at this time. The members of our committee wanted to direct your attention to the Senate review. It's written to the A9 amendment. That's with the A9 as an accepted proposed amendment, and that'll give you a little better idea to follow along with the bill. We'll open it up for questions. Who would like to begin, if any? Senator Relph.
Thank you, excuse me. Thank you, Mr. Chair. I'm not sure who this question should be directed at. I have several actually, but one of them we've spoken here quite extensively about the under the influence and the fact that there is an effect of marijuana. Most of you know you get high, and one of the big issues that concerns me is the correlation between the quantity of THC in the system and the effect on an individual. We have pretty good studies that show that at a certain blood alcohol content, everyone is impaired. That changes over the course with some people who are smaller, have different metabolism, but at some point in time, everyone is impaired. The question I have, and I'm not sure if there's someone here can answer it, at what point in the consumption of marijuana is someone impaired? Is there an objective test? Has there been an objective study? Is there any information at all that tells us when everyone is impaired? And that's the question that I would ask, because this leads to many, many, many issues in terms of liability for commercial drivers, in terms of liability, but most importantly, in terms of understanding how much of this drug you should have in your system when you get behind the wheel.
Mr. Chair. Franzen.
Thank you, Mr. Chair and Senator Relph. I think that's a valid question that most of us, if not all of us, have, because cannabis is illegal. So, and technically, it's still illegal to drive impaired regardless of what substance you're using, whether it's opioids that your doctor prescribes today, whether it's alcohol that you can buy legally in the liquor store. The question is, how are these states adapting to have testing that would actually help them police our roads and making sure that they're safe? And what I've been told is that the science is there and there's been movement in that direction. Right now, people are driving when there's medical cannabis legal in this state. So I probably have that answer more come from public safety, because they do field sobriety. That's how they're doing it now. But Senator, or my co-author here, also has some ideas of how to answer that question from a medical standpoint.
Senator Jensen.
Thank you, Mr. Chair, and thank you, Senator Franzen, and thank you, Senator Relph. Basically, alcohol and the, if you will, the blood alcohol level, the BAC, it's a linear slope. You can put on the x-axis and the y-axis, and you can see that the more the BAC goes up, the more the impairment. With alcohol, with THC, it's more of a parabola, and many states have gone with, some have gone with per se, where if there's any. And it's actually not THC, it's actually a metabolite. It's carboxy-THC, and it isn't psychoactive. But the bottom line is some states will say anything at all is enough to be a contributing factor to an arrest, 2 nanograms per cc or 5 nanograms. And some states do none and just say, we're just going to use in-field sobriety testing. It is extremely difficult, and that's one of the reasons why I think Senator Franzen and I are so appreciative of the committee for having this hearing, so we flesh some of these issues out, because clearly that's not settled science yet.
Is there anyone from the law enforcement community that would like to address the issue of how to determine impairment caused by marijuana? Sheriff?
Thank you, Chair.
Sheriff Torgerson.
I mentioned it real briefly in my comments related to DREs, drug recognition experts. Not every agency has them. It's very expensive, and it's a very intensive amount of training to get there. The senator is absolutely right as far as how to tell. Right now in Minnesota, it's a presence as to if the drug is in the system, if marijuana is in there. The metabolites are there. It's under the influence, and that's all we have. The DRE is simply able to determine whether or not the drug is in the system. There's no way to know how much is in there and what is impaired. That's the difficult part of it. And at this point, yeah, there's a lot of research. I think there's a lot of studies going on, but I don't think they found a definitive way to prove it and to identify what's safe and what's not safe.
Right. Senator Ingebrigtsen? Oh, Senator Relph.
So I kind of would like to go back to the idea of the people who want to use marijuana responsibly. And I think there are many who do, and I think there are many who are very careful about it. But do they have any way of knowing when they are impaired and when they are not? I have a pretty good idea when I've had too much to drink, and I stay below that. I don't know how I would react with marijuana. And I guess this is the question I have, that we need to be able to do that before we turn this loose on our society. And so I'm very concerned about that.
Mr. Chair and Senator Relph, and I agree. I mean, right now you probably look at your liquor bottle or your beer can and say, you know, this has whatever percentage of alcohol content, and you kind of know because you hopefully drink responsibly in the comfort of your own home, and you know sort of how to measure what your body is able to tolerate. For cannabis, we don't have that. People are buying this stuff off the street, laced with whatever synthetic drugs, so they have no idea what they're consuming. So part of the responsible conversation that I think we're bringing today, not to say that this will pass today or tomorrow, is to talk about these issues. Like, I think there's a public interest in people knowing what they're consuming, what they're putting in their body, like a beer can, like a liquor bottle. You know how much content of alcohol is in there, and you have a way of knowing how your body reacts to that. Right now, we have nothing. People are consuming edibles, and they have nothing. They have no idea what's in a cookie or in a gummy. They know that it has an effect on them, but we have further educate the public of what is, what's considered safe.
Mr. Chair.
Senator Jensen.
Thank you, Mr. Chair. Thank you, Sarah. Because of medical marijuana, we are starting to dial in what a 5 milligram gummy bear or tablet or edible, whatever we use. So, I mean, we're starting to see that. So patients that are on, say, medical marijuana or medical cannabis for a seizure disorder, we know that 5 milligrams daily may well take care of the seizure problem. The 10 milligrams, they experience adverse side effects. So we're starting to dial that in because of some of the medical marijuana experience we're gaining.
Mr. Chair, just one last comment. Thank you for that, Dr. Jensen. Being one of the co-chairs of the Medical Cannabis Commission, I am very concerned about bringing medical cannabis to people because I think it has a great benefit. And I think it also will lead to some better measurement of the impacts. But at this point in time, I think that the measurement has strictly been trying to look at, does it relate to a specific symptom? Does it cure a specific ailment? And not looking at the overall effect of the high, so to speak, that is the impairment of judgment. And this is the key that I feel we have to look at. When is your judgment impaired? Because that's what this does. Thank you.